We did not qualify for any of the welfare or medical card programs, and BCMH paid for his surgery, doctor follow-ups, the county health nurse checking up on him, and the hearing aids. He does have hearing aids now, and they do pick up that kind of a cost too.
You get a lot of these medical bills, and they pile up, you know. And you know, you might make halfway decent money, but you got a major, you know, bill, you know. It could be, you know, gone like that.
We really make too much money to go on welfare, but we don't have enough money to do what has to be done. I don't think we were ever made to feel like we were charity cases. When she was admitted to the hospital, as if anybody else was admitted to the hospital, I think she got excellent medical care.
We as a family have to stay strong so that we can be a resource to Zach as he goes through his life. But at the same time, we're affected by the disability, and sometimes we need outside supports to keep us strong as a family.
We are able to serve in some way virtually every Ohio child who has or may have a chronic medical handicap. Based on national statistics, 5% of Ohio children under the age of 21 are limited in their activities due to a medical handicap. And of those, 1 in 5 may have a severe chronic illness.
In 1919, Ohio created its first statewide program to fund medical services for children with physical handicaps. Ohio's early programs were designed to serve children with orthopedic conditions. By the early 1970s, Ohio had already realized a responsibility to all Ohio children with chronic medical conditions and to local health agencies that could serve children and families through community-based programs. In 1974, Ohio transferred its assistance program for children with chronic medical conditions from the State Department of Public Welfare to the Department of Health. In 1986, the agency's name was changed from the Bureau of Crippled Children Services to the Bureau for Children with Medical Handicaps. BCMH operates today as a unit of the Ohio Department of Health, Division of Maternal and Child Health.
There are two major thrusts of the program for the Bureau for Children with Medical Handicaps. The first is the early identification and diagnostic referral services for youngsters with handicaps or at risk of having a handicap. This program provides payments for physicians and other providers for test, lab fees, limited hospitalization, and related medical services. The second program supports ongoing treatment for medically eligible children who are also financially eligible. This program pays for doctor visits, tests, hospitalization, surgical services, medicines, braces, wheelchairs, and other medical needs.
The provides support to Ohio's communities through field clinics and service coordination programs. Any Ohio resident under the age of 21 who has or may have a medical handicap may receive assistance through the BCMH diagnostic program. Diagnostic services for a broad range of conditions may be provided for up to 3 months at no cost to the family.
With Jess, he has been through the speech evaluations. They have done hearing evaluations for us. We're still in the process of trying to find out why he isn't talking and why he back knees when he walks, etc. So we're still involved with BCMH through diagnostic.
Medically and financially eligible families may also receive ongoing assistance with treatment services through payments to providers. Under the BCMH treatment program, assistance may be provided until the child reaches age 21, if the handicapping condition continues and the family remains financially eligible.
Wheelchairs, surgeries, it's almost overwhelming at times. We just go on from day to day and do whatever. There's been little things that have disturbed us, but on the whole, I think the financial problems sometimes are just overwhelming.
The impact of a severe handicap on a family can be devastating, both emotionally and financially. The ultimate objective is to strengthen homes and families. That begins with community-based services and close working relationships with specialized child care centers, local health agencies, and providers.
It's allowed things that myself financially probably couldn't have done, such as his electric wheelchair, his hand operating wheelchair, which he can use with one hand, you know, and still operate it and maneuver through. His ASO braces, they helped him with us on the surgery. As far as they helped him, you know, without that, he wouldn't be where he's at today.
The Bureau for Children with Medical Handicaps recognizes parents and families as the most immediate and responsible information sources, caregivers, and advocates. Community-based services that strengthen and support the family's role are essential to the BCMH program. Those services are coordinated with local health agencies through public health nursing visits.
The parents really guide me into what avenues we're going to investigate in helping the child and the family. That may be finding proper care for them, maybe not a specialist, but a general pediatrician that'll give the immunizations and take care of their ear infections. It could be linking them up with an agency that will help provide equipment that's needed for the children, or finding therapy for them, or finding special programs. A lot of the work that I do with the family is done by phone in contacting other services for them. The families use me as a resource and know that they can call with questions or concerns during my visits. The frequency of visits vary depending upon the needs of the family at the time. Sometimes once a year is all I need. Sometimes if they're in crisis, it might be every couple or 3 months for a while to help them over a difficult time.
And it's been real helpful to have that kind of a support network. The county health nurses come to our home a couple times and to do review cases and to see Chris and how he's progressing. And it's really nice to see somebody from the outside say, oh, he's doing wonderful. You can think in your own mind, yeah, he's doing great, but you don't know for sure until somebody else sees it and says, oh yeah, look at everything he's doing. And it just kind of reinforces you and make you feel like you're doing something worthwhile.
The objective of local public health agencies and that of BCMH is to provide quality care to every Ohio child. More than 4,000 physicians, dentists, and other healthcare professionals are approved to provide BCMH-funded services. Included in the BCMH network are hospitals designated to provide comprehensive, general, outpatient, and specialized team services. An application for diagnostic or treatment services is submitted on behalf of the family by a BCMH-approved physician. The applying physician also manages the child's care. BCMH medical reviewers carefully consider each application submitted and authorize appropriate services. If ongoing treatment services are requested, the family also submits a financial application form and income documentation for review by the Bureau's resource payments staff.
When reviewing applications to determine medical eligibility, we look at information provided about the child, the physician, and their requested services. First, we need to determine that the child is under 21 years of age, is a resident of Ohio, and has a diagnosis eligible for either the diagnostic or treatment program. The child's physician is required to be a BCMH provider in an appropriate specialty, and the services requested must be related to the child's handicapping condition. We need both the physician's signature on the application and the parent or guardian signature of information. Finally, the request for services must be received by the Bureau prior to or within 30 days of the initial date of service in order for authorization of services on that date to be considered.
We've received really no help other than that from which we've received from the BCMH. Our hospitalization that we have pays for the doctor visits for the children, but as far as medical equipment, we have no source of, other than the BCMH, who will pay for medical equipment.
I checked into Medicare, Medicaid, because, you know, nothing was getting paid, you know. And, you know, these plastic surgeries aren't cheap, you know. And to qualify for that kind of stuff, you pretty much have to lose everything you have and not have any money at all. And that wasn't our situation, that we just needed some kind of help.
Shoes, when they cost $110 a shoe, not a pair, are a little expensive to buy, but because they have to be fixed so they'll fit on the braces, they've just been very good about buying equipment when insurances won't always do that.
To learn more about the Ohio Bureau for Children with Medical Handicaps and the Bureau's diagnostic and treatment programs, you may call the Bureau at area code 614-466-1700. Information about the Bureau's programs is also available from your local health department or health district office, and from your child's pediatrician.